Alrighty, well, welcome everyone again. Actually, happy International Women's Day, which is today. Um, we're honored to have Dr. Ruggeri here today. Dr. Ruggeri is from Cordoba, Argentina, and immigrated to the United States. She commenced her education at Santa Monica College and transferred to UCLA and completed her Bachelor's of Science in Physiological Science. She completed her medical degree at the David Geffen School of Medicine at UCLA, subsequently completed her residency in emergency medicine at the Weill Cornell College of Medicine in the heart of New York City and a fellowship in EMS and tactical medicine. Currently holds She currently holds many roles. In addition to being an emergency medicine physician in Los Angeles, she's a paramedic educator, works with the Los Angeles County Jail System, serves as the medical director of the LAPD SWAT team. She is also a Spanish podcaster with MRAP Go. Dr. Ruggeri is a breast cancer survivor and a proud mother of 3 children. So thank you again for joining us.
Good morning, everyone. All right, should we get started? Okay, so I have, thank you everyone for joining this morning, and thank you Pre-Med CC for inviting me. This is my second time with you guys, and thank you for putting time in your Saturday morning to listen to me. So I'll just give you sort of a quick description of my journey into medicine and to emergency medicine in particular, and then I would love for you guys to ask lots of questions. Sometimes we don't have a person to reach out to that is actually working in the field we want to. And so please take advantage and ask me anything, even if it's not about medicine, other ideas that might come when you think about being a doctor in your real life and other interests that you may have. So let me share my screen. Let's see if I can. Yes, okay. So again, my name is Dr. Wendy Ruggeri. I'm an emergency medicine doctor. So I've been in the ER field for about 13 years, and currently I work in downtown LA at California Hospital. I've worked as a full-time doc there for maybe 12 years. And then recently I transitioned to the LA County Jail facilities. So I run the urgent care inside the LA County Jail. So that also may bring lots of questions, which I'm happy to answer. And I also oversee some of the primary care clinics within the jail. The jail is a pretty large system with a population of about 12,000 inmates. So it's like taking care of a little town in itself. But that's where I am now. So I like this picture because I want to show you guys that this was little me at maybe 3 or 4 years old. And then my dad, who's holding me, was a handyman. Didn't finish high school. He got a GED when he moved to the US. Then my grandma and my sister, and then my mom was a hairdresser, and my uncle was also, who's standing next to her, was also a handyman. So they worked together. And that little random kid, I have no idea who he is. There's always a random kid in these pictures. And so I don't know about him, but no doctors in my family. That's the point of this picture. So I'll tell you a little bit about more of how I found out how to be a doctor, but I'm originally from Argentina. I was actually born in the US and I moved when I was 5 years old. My parents are both from Argentina. They were living here. So I was born here and then they decided to move back. Argentina is all the way down, right? It's like a 16-hour flight. And the best thing, the food, the pizza, the soccer, and the asados, which are the barbecues, are amazing. So I spent from age 5 to age 18 in Argentina. So I completed all my elementary and high school years there. And then when I was ready to enroll into the medical school, my parents decided to move back to the US. So I was completely lost. I had no clue. In reality, I thought it was pretty simple because, as many of you may know, in most countries in the rest of the world, you finish high school and you enroll in your career of choice. There is no undergrad or no college like here. So I assumed I was moving to the US. I was just going to enroll in med school and be a doctor. And that was it. But that was certainly not the case. So I like quotes a lot. So I'm just going to share this one with you guys. So every accomplishment starts with a decision to try. So whatever it is that you're trying to get done, whether it's medical school or getting out of bed and going to the gym, you have to try it, right? You have to take that first step, and then you may say, well, this was not for me, but if you don't try, it will never happen. So I moved to the US. I was 18. I had no idea how to become a doctor. We ended up by chance moving to Santa Monica because my uncle was living there. And so my dad was like, I think there's a school around the corner. You should just go and sign up for medical school. So I went to SMC and quickly found out that is not what I was doing. So most people, do 2 years maybe at a community college and then transfer. So it took me 3 years because I really had no clue what I was doing. I found out later I was taking classes that were non-transferable, et cetera. But overall, it was a good experience. I spent 3 years at SMC. Again, if you decide to go into this journey, whether it's medical school or maybe some other health path, good things take a long time, right? You cannot expect, I feel like I have a 14-year-old daughter and everything has to be immediate gratification, right? Like you do something and then you see a result right away. And if that's not the case, it becomes very frustrating. But I think you guys are on this journey and you know that great things take time. So trust the process, that greatness is coming for sure. So after let me go back real quick. So after I went to SMC, I transferred to UCLA. I was a Phi-Sci major. And so I did 5 years total of undergrad. I applied to medical school. I, at the time, did not have the best advice. So I'm hoping you guys will get better advice than I had at your stage. But I only applied to 7 medical schools. And all of them said no. I was not the best. I didn't have the highest GPA. I wasn't the best in my class. So 7 schools, all of them said no. And so I enrolled in a post-bac program at UC Irvine. So I moved to UC Irvine. I had taken the MCAT twice. I started preparing again for the MCAT. So essentially, I was hating my life over the summer, studying again for the MCAT and this post-bac program that was pretty promising. And 2 weeks into the program, they called me that they had pulled me from the waiting list at UCLA. I will never know why or understand how these things happen. Of course, you carry the imposter syndrome for years, but that's what happened. So I ended up moving away from Irvine. I had just gotten all my stuff in, came back, and started my journey at UCLA School of Medicine. So it was fantastic. Some of my best friends are still my best friends from UCLA. And so I want to share this quote, which I think is very relevant to pre-meds. So people that say cannot be done should not interrupt those who are doing it, right? So we get a lot of advice from uncles, from neighbors, from cousins, from colleagues. All these people want to tell you about, or give an opinion on your journey through undergrad and with your goals of becoming doctors or other health professionals. And in reality, they have no clue what they're talking about. So be very cognizant of who you get advice from. Even sometimes counselors, don't give the best advice. But unless, if you are told, oh, it's going to take forever, like don't do med school, it's just a very long time, you should perhaps, choose a shorter career path. Well, have you done that path? Like, are you speaking to somebody who has actually gone through that path? Or is this your neighbor who has a pizza shop, right? Who's giving you advice on, oh, you're going to spend 12 years going to school for what, right? So don't listen to those, don't let those people who have just random advice interrupt your goals, essentially. So this is my crew from medical school. These are still my very best friends to this day. On the picture of the right, this was my core group, and this is important in any stage of your life, but we studied together, we partied together, we did all these things because it was a challenge for all of us. All of the females in this group to the right come from families with no doctors. And so we bonded a lot in that sense that we were first generation, and we were kind of finding our path together. And it was so, so important because at times it felt like, you can feel alone. You can feel like this imposter syndrome carries, like, why did they pick me? Did they make a mistake? Was I supposed to be pulled from this wait list? And then in the end, you realize, yes, they saw something in you that perhaps you did not see at the time. That was, that's your value. And that's why they picked you out of this wait list to add you to this medical school class. And I absolutely believe that now, even though I didn't see it at the time. So from left to right, Dr. G is a family medicine physician, then it's myself, and then Dr. Lopez is also family medicine. And Dr. Ceballos, next to her, is a OBGYN in Las Vegas. Dr. Momi is a vascular surgeon. And Dr. Quijano is an anesthesiologist. So they are all amazing, amazing people. My next quote is, impossible is temporary, right? So when you hit that point where you are like, this is it, this is not happening, I'm putting all this effort into it, and I'm not seeing the results, just remember, impossible is temporary. Things will happen. You will, it'll take a longer time, it'll take a little bit more effort, but it will happen. So I graduated medical school, and this picture in the white coat is my very first day as a true doctor, like a true doctor where patients approach you to ask you questions and you get tachycardic because, you are a medical student and for 4 years, and then literally on a Friday, you're a medical student, and then on a Monday, you are an actual doctor in a hospital. And so it's a big, big change, right? So that was my very, very first day. And that happened at Highland Hospital, where I did my transitional year. So after medical school, I did 4 more years of training. The first year is called the transitional year, where you do like different rotations. And then I did 3 years of emergency medicine. So that very first year was at Highland Hospital in Oakland, California. And then the subsequent 3 years were in the Bronx in New York. So my year at Highland was fantastic. Super fun, lots of trauma, like you're familiar with, a great emergency room to get trained at. I rotated with the surgery team, in the ICU, like you go through all these phases. I even did a elective in Italy. So to me, Highland is amazing because they allowed me to do a dermatology elective in Italy. That was amazing. Anyways, that year was over and I moved to the Bronx. I was really sad to actually move. I was hoping to stay in LA for my emergency medicine training. Obviously, many of the top programs are in LA. And so I was really, really hopeful that I would get to train here. And then when I didn't get picked, because as you guys may know, there's a matching system. So you take all these, right, your exams or your USMLEs, all these things. And then they look at your scores and other things. And then they put you on a ranking list, and then you interview in certain programs, and they put you on a ranking list, and then there's a match. And so on match day, you are told where you're going to go. You don't really get to pick. You were just told where you matched. And so I was hoping to match in LA, which I didn't. And I was super sad and sort of felt again like a failure. Like some of my friends were staying in LA. I didn't really know much about New York, and I wasn't excited about going. And it ended up being 3 of the best years of my life. It was amazing to be able to train in the Bronx. And in the end, what I tell everyone is that I spent that time in New York, which initially made me really sad and made me feel incapable of doing great things, which was not true. I did my training, and then I came back to LA, and I am working in the same emergency rooms with the colleagues and people that train at those programs where I did not get into, but I still went to a great program, and we're all working together. So in the end, as long as you get your training in your specialty, you can always come back to that city that you wanted to live in, or wherever it's just temporary. Like I said before, like these efforts, these little pushes that you have to do in your life are temporary, and then you can sort of reshuffle and accommodate and be where you want to be. So I'll tell you the picture of the katana on the right. So that was I think it was my first week as a ER resident. And a patient came in saying that he was sleeping with a katana and it was embedded in his neck. And so, of course, as a eager resident, the first thing I did was take it out, which you're not supposed to take it out. So anytime you have an impaled object in yourself, you leave it there until the situation is stable, which it was. He was already in the emergency room. But that was his story. Who knows what really happened? But he said he was sleeping with a katana, and it was sort of in this parallel plane, so it wasn't going straight in. So he made it, and he was okay. I also want to share with you other fun things you can do, right? So as an ER resident, you're already a doctor, so you can already start doing things outside of just going to the ER every day. So I've done that starting a residency until this day. So I'm just sharing with you some of the fun things you can do outside of the hospital. So I was working with a group that did dignitary medicine in New York City. So we participated in the UN Assembly every year. I got to shake Obama's hand. We would get called to like hotel rooms if there was a dignitary from some country and go and assess them, and that sort of stuff. So that was really fun. And that sort of led me to other things I did later on. These pictures are special to me because the doctors only sign was the first time I got to park in the hospital where it says doctors only. And so that was a proud moment for me. And I like the picture to the right that just kind of describes emergency medicine doctors. Multitasking, problem solving, requires coffee, will travel, obviously, right? We all love to travel and do sort of adventure medicine as well. Sarcasm, always, adult language, always. And so in contents may vary in color, right? So very diverse group of physicians, which I love. Other things I love about emergency medicine is that you do shift work, right? So you are, you have to work some weekends, some nights, but then you're off on a Tuesday or on a Wednesday and you can do random things. Like I can go to my kid's school and read a book, or I can, it just gives you a lot of flexibility. The other good thing is that you choose how many shifts a month you want to work. So if you want to be a tired, cranky billionaire and you want to work 30 shifts a month, you can do that and you can make all this money and be exhausted all day long. Or if you have somebody to support you and you want to work 2 shifts a month and that's enough for you, then that's what you can do, right? And if you want to find that mid-level where you know how much income you would want and what lifestyle you would want, then you, like for me that was maybe like 10 to 14 shifts. And then if 1 month you need more money, you work 5 extra shifts, right? So it's very flexible and sort of adaptable to your lifestyle and how you want to do things. The other great thing is that you are never on call, right? So if you become a surgeon, or a OB doctor, you carry a pager and you are called in, right, when there's something needed or an emergency. So with emergency medicine, there are no pagers, there are no being on call. So you work a shift from maybe like, I don't know, 6 in the morning to 4 p.m., or you may work a night shift from 8 p.m. to 6 a.m., and then you're done, right? You may take a little while. Maybe you don't leave at 6 a.m., which happens very often. You end up leaving at 7. But then you are home and you're home, and nobody will call you to go in anywhere. And that's it. You kind of like can divide that, your work life and then your personal life. So I really like that as well.
Can you explain to them what a pager is?
Oh yeah, what a pager is. So a pager is like a little device that I think they still carry, which you carry on you, and it goes off or it rings when you are needed in the hospital. So essentially, you get a callback number, and you call that number, and it's the hospital saying, "Oh, I have this case. You need to come in," etc. Right? So now, telephones may replace that, or apps or other things. But the point is that you are still called in on your off hours. Of course, when you're on call in any specialty, you get paid for being on call. This is not like free work that you're doing, but emergency medicine does not have any work outside of your shift. Let's see. Some other pictures I want to share with you. This is just a chest tube that I was placing just to show you some procedures that we do in the emergency room. So the picture to the left and the top is a chest, and you're looking at the lateral side of the chest. So when somebody has a penetrating injury in their chest and they may have a collapsed lung, we have to put a tube right in there to drain the air that comes out of the chest. And it's really fun. These are all really fun procedures. You actually put a little numbing medicine, you find a spot in between 2 ribs, and you have to feel with your finger. You make a little cut, and then you make a deeper cut, and you actually put your finger in there and create some space to put this tube in. And then when you put the tube in, it sounds like a punctured tire, and you hear the air come out like, shh, and suddenly the patient becomes better, their blood pressure is better. You are saving the patient, essentially. The picture at the bottom with Dr. Erasmo is just a story I like, because when I was at you guys' stage, I was a pre-med, I was an undergrad at UCLA. I did a summer program at UCLA called Prep that some of you may be familiar with. And so it was maybe like 4 weeks of this pre-med summer program. Also for those like were first generation, kind of was very inspirational. And so I met Ursno at that program when we were in our 20s, and I never saw him again, ever. And then maybe 20 years later, after that summer program as undergrads, I called for an ortho consult in my emergency room, and down comes Ursno as a orthopedic doctor. And we both looked at each other and we were like, no way. Like, and so it was a great to meet him again, knowing that we both came from like these backgrounds of not having anybody in our families, being so clueless. And now he's an amazing spine doctor. And I was there in the emergency room, and we collaborated, and we were able to help our patient together. And that was a great moment for me. And then to the right is our sort of like the first COVID, the initial COVID times, which were a huge deal. I don't want to do that ever again. I was in the emergency room during the entire COVID pandemic, intubating patients, lots of uncertainty, lots of, developing protocols every 3 minutes because things that we were doing were not working, having hospital staff affected, some of our own PAs that were in the ICU intubated. So it was very stressful. But of course I learned a lot, but I don't want to do that ever again. I will not wear a mask. I have like PTSD from wearing masks for like 10 hours in a row. So yeah, that was COVID. A quick plug-in for, I'm from Argentina. So really important to increase the number of Latinos in medicine. We have a National Latino Physician Day that was implemented maybe 3 years ago. So just so you guys know, for example, nationwide, only 6% are of all doctors are Latino, and 2.4 are female. So that is just insane. So whatever your background is, if you are from a minority, we need you in medicine. We need minorities in medicine. We have such a need of, with our population so diverse, we need physicians that can connect with their population, right? So again, even if you're not Latino, or if you are, even better, but whatever your background is, I'm sure the patients from your background need you, right? We have so many at the jail. We have so many Armenian patients. We have so many, there's other, depending on where you go in LA, you will find your little pockets. But to me, that's a huge indicator of where I am needed as a doctor. So my dad, to this day, asks me, why don't I work at Cedars-Sinai or Santa Monica, right? So those are, to me, those are like boring places where you treat like anxiety and depression all day. So I realize my potential to help these populations, these underserved populations, these Latino population, which is what I can serve because I am bilingual, I am bicultural, and I know I can serve this population best. So that's why I work in downtown LA. That's why I work at the jail. So find your purpose within medicine, right? Find where you are needed, because that will be reflected in your application as well. Like, this is why I'm special, right? This is why you need me, because I speak this language, because I am bicultural, because I understand this population who has a whatever percentage of doctors, right? So you are needed in this field of medicine. Other things I've done, I've spoken at other international conferences in Argentina for their emergency medicine societies. I've participated in podcasts. So again, the door's open. You can do all sorts of things, because I also feel like if all you do is go to the ER every day, and you work your 10-hour shift, the burnout comes very quickly. So you have to diversify your life, your profession, your activities. Otherwise, if you do the same thing, it gets pretty exhausting pretty quickly. Other things I've done is work with LAPD SWAT. So really fun stuff. Again, I have provided them with medical advice, essentially. So when the SWAT team goes out, there's a high risk of injury, penetrating injury mainly for the officers. And also now they are obligated to attend to the victim, whether it's the person they were chasing or whoever it is, until the ambulance arrives, they have to render care. And so teaching them about tourniquets, about applying pressure on a wound, about, basic CPR. So all that stuff, our law enforcement needs to know that. Now it's more and more a requirement. When I started, it wasn't as much as a requirement. So it's really fun to be able to educate and help and be part of a team with these kind of like tactics. Okay, let's see this quote. You'd be surprised who's watching your journey and being inspired by it. So don't quit. So it doesn't matter at what level you are, if you're an undergrad now or wherever you are in your journey, you have a little cousin that's watching you. You have a neighbor that's listening to you. You have somebody that is a couple of steps behind you that is looking up to you. So don't forget to always kind of look back and help whoever's coming next, right? So you have made it to undergrad. Maybe somebody needs help graduating high school, right? So always try to inspire others. And even if you think you are terrible and you suck, no, that is not the case. Somebody is looking up to you. You are an example for somebody. And then the other thing I like to think about, I think it's just a very basic phrase that helps me when I am feeling like this is not going, this is not working out for me. I'm not smart enough. I'm not capable enough. Just think, who better than me, right? Who better than me than to take this class and ace it? Who better than me to become a doctor in this field and be the best, I don't know, ophthalmologist I can be, right? Who better than me? Because I have the drive, I have this, I have that, right? Just kind of talk to yourself and say, who better than me to get this done? So that's all I have. And yeah, maybe we can open it up to questions and
First question is, in LA, I assume I assume it's Spanish, but what other foreign languages patients speak that are common to encounter, especially in the ED? Do you think that it would be helpful learning languages that are likely to pop up more?
So I would say in LA, Spanish predominates, but you have little pockets of, I have friends that work in other areas. My friend is Persian and she likes working at another hospital with a large, older Persian population. And she loves it because she is a, great help and she connects with her patients. And so LA is so diverse that, and there's so many languages. I see a lot of Korean patients in the emergency room. Again, I see a lot of Armenian patients, a lot of Russian patients. So there's just a lot. But if you had to go with one language, I would say learn Spanish because it's, I feel like it's the greatest. Almost 40% of the state is of Latino background. And I would also encourage you to not assume you know a language, like it's in a way a little disrespectful for the patient, right? If I think I know Armenian and I throw 5 words and I think I know how to speak it, that's disrespectful because I'm not really allowing the patient to give their story, to tell me how they feel. So using interpreter services is a huge, huge advantage, and you should use it if you are not proficient in one language. But for sure, you will encounter patients in many, many languages. And sometimes in the emergency room, we have to make decisions without communicating with the patient at all, right? So we see babies that cannot speak. We see elderly patients who cannot speak. We see patients with strokes who can't speak. And we also at times have a language barrier that needs a decision which is immediate, and I may not have time to get the laptop and get the interpreter, and I just have to act based on vital signs and what I have, right? So there's this kind of all kind of situations, but always get an interpreter if you need it.
Yeah, and some hospitals don't have them.
Yeah.
If you were an emergency medicine physician, what specialty do you think you would have done?
I struggled because at my 3rd and 4th year of med school, I loved after rotating through, you rotate through all these specialties and you get kind of a glimpse in your 3rd year. And then you can choose in your 4th year, if there's something that you like, you can do another rotation with more responsibilities. It's called a sub-internship. So you choose which sub-I you want to do to kind of get a better exposure. And you're also treated as a resident kind of. So I did a sub-I in OBGYN, and then I did a sub-I or a sub-internship in emergency medicine. It's a month-long rotation where you're given more responsibilities, you're expecting, the expectations are much higher from you. And so I did a full month of both, and I could not decide between OBGYN and emergency medicine. And it was really hard. And so after doing a month of both, I still could not decide because I loved both. So what I did is I reached out to people that had been working in the field for many years. And so I spoke to, a couple of OBGYNs, and then I spoke to a couple of ER doctors. And sadly enough, the OBGYNs were all completely burnt out and actually working in other fields. And I feel, even though I loved OBGYN, the residency is really hard, long hours and all that stuff. But then the lifestyle kind of continues that way. Because even if you join, and this, you guys should speak to an OB if you're thinking about that. But I thought, from what I heard, that if you join a group and you become an OB, even if you share the pager and the being on call and the whole thing, 99% of the times you also are called in and you have to go in, at when you're home with your family, etc. So I really like the idea of not being expected to go to work once I'm home with my family. Emergency medicine deals with everything. So I really like the idea of taking care of babies up until elderly patients. So I like procedures a lot, and that has a lot of overlap with OBGYN. The OBGYNs are surgeons, so there's a lot of time spent in the OR, and I really love the OR and I love surgery too, but I went for emergency medicine.
They want to know how do you deal with imposter syndrome?
How do you deal with imposter syndrome? So I'll tell you, it still creeps in at times. And I think with time, again, you have to find the value in yourself, which you may not see at this time. But just remember that you have your unique qualities and you have a lot to offer. So what I've realized over the years is that, we're all good at different things within medicine, right? So I realized, for example, that I am good connecting with the patient. So when I have, I may have another doctor that saw a patient that had to go home and then signs out the patient to me. And once I start speaking to the patient, they actually tell me all the stuff that they didn't tell the other doctor for some reason. So I realize that is my value, right? Or sometimes it happens that they are cursing and they are like agitated and they don't want to speak to anybody and they're like mistreating the nurse and everybody else. And then I walk in and I'm able to kind of calm the patient down and have a dialogue and see how I can help them. So I realize that's my value, but that takes time, right? Once you start kind of picking up on what you're good at, then you like just hang on to that, right? Once you find something you're good at, just say, oh, I'm good at this, right? And then with time, you add something else that you're good at. And then once you realize you're good at this and this, you're like, oh, I think I'm a little better at this than the rest. And, as much as you're kind of picking those things you're good at, it's also important to recognize, well, I need help with this, right? So I'm good at this and I need help with this. So I think with time, you kind of get better at it, but just again, know your value, know what you are special because it's you and you are different than the person next to you. So it's important to bring that out and be able to talk about that and, be confident about it, but it's a struggle. I agree.
The question is, what did you work through this whole process of like probably like undergrad and medical school?
Did I work? So I did work in undergrad. I did not work in medical school. I would say most people don't work in medical school. But in undergrad, I'll tell you all the odd jobs I had. So my very first job when I was at SNC, I worked at the Disney store. My second job was I worked at Abercrombie and Fitch. And then I realized all these pre-meds were doing like internships and like things I wasn't even aware of. So then I switched gears when I was at undergrad at UCLA. I joined pre-med groups like you guys are doing now. And I realized like, no, I need to like be doing other stuff. So then I started doing research as an undergrad at UCLA. That was helpful for my like application, but in honesty, I hated it. I hated research. I'm not a research person at all, but I did work as an undergrad on campus doing research.
Um, and you in medical school, did you work at all?
I did not work. I only knew one person that worked during medical school. Again, most people don't because it's so sort of intense that they will give you all the financial aid you need in order not to work. You are not expected to work. I think it would be very difficult to work and go to medical school. But one of my friends, Dr. Ceballos, who's in that picture, she was actually an ER nurse before becoming before getting into medical school. So she would pick up shifts and work as a nurse in the ER. So she was the only one that had money all the time that we were all poor and broke. She was the one to take us out for a drink, but no one else worked, and I did not work.
I want to be her friend. Um, the other question is, what is one piece of advice would you give to yourself or to a first-year community college student who is unsure where to begin with the medical school process?
So that's a great question. I think it's crucial to join these sort of groups where you connect with other people who are going through your same path and have your same goal. In that way, there's kind of an outline of what steps do I need to take to get into medical school. It can be very overwhelming. I absolutely agree. So I think, to me, joining a pre-medical group, maybe doing some volunteer activities, like volunteer at a hospital and kind of get a sense of what that feels like. A lot of students shadow doctors. If you are going to get a job as an undergrad, I love the idea of being a scribe. If you guys don't know what a scribe is a person with a laptop that follows the doctor when they go see a patient and they document everything that happens. You get paid, right? It's a job. And at the same time, you are learning all of the vocabulary. You are learning, how to structure a note. All the things we learn in medical school, scribes are amazing at, and they're undergrads who want to go to med school. So becoming a scribe is a great idea, and it also looks good on your application. But you actually, the scribes that work with me in the ER go into the traumas, and like as I'm doing stuff, they are in there. And so it's a good chance to get exposed without just kind of standing there and shadowing somebody, which is really boring. You're actually part of the team, right? And then again, as an undergrad, I also volunteered. I went to Mexico and we did like all these free clinics, which was super inspirational for me. So I think all those things you can start doing. I also want to tell you guys about, I don't know if anybody's familiar with mimentor.org. So mimentor.org is an organization I helped found, and it's also for minorities, like pre-health students who are minorities. And there's tons of resources of, conferences, meetings, sessions, to write statements, to review statements, to interview, like tons of stuff there. Thank you for putting that up.
Yeah, we repost a lot of their stuff and they repost a lot of
Awesome.
our stuff. Do you know Efrain then?
Yes, I went to medical school with Efrain. Yes.
Really?
Yeah.
But Efrain's so much older than you.
Oh, see how long are you? No, we all went to med school together. They were
Oh wow.
yeah, they had their little crew of
Small world. That is one thing I would tell you this, guys, is that medicine is so small that everybody knows everyone. So
in a way,
I
yeah.
have the fortunate uh, to work, you know, but everybody knows each other, which is like such a small world. But
Yep.
so know that the only advice that I would tell people in community college the first year is learn your style, how you learn, because nobody's
Yeah.
going to teach you that, and you don't want to have to relearn it so learn if you're a visual learner, and there's learning tests you could take on the quiz. Um, this is a question. Did you shadow a doctor during your undergrad or post-bag? If so, how did you go about it, and how do you contact a doctor to shadow? And I think Dr. Ruggeri talked about this just a second ago. Do you want to add anything else to that?
I'll tell you, in my undergrad years, the scribe was not an option. That's why I encourage everybody to do it now. I initially, like my very first hospital job was a volunteer. I was changing sheets. I was giving the patients water that were able to get water. The basics of being in an emergency room, which I think was a good first step. I would go Friday afternoons and spend 4 hours there and kind of help the nurses and what I could. And that just kind of gives you a vibe of what it feels like to be there. But again, being a scribe is 1,000 times better than that. Finding a doctor to shadow is challenging. I'm not full-time anymore in the emergency room, so I can't really offer shadows. And when I did, it was kind of like under the rug because they're not, you have to go through the whole volunteer office thing. So I would sometimes bring students in for a little bit, but I think becoming a scribe, because when you become a scribe, you can work, 8 hours a week, and that's your, so it's very flexible again. And doctors love scribes. So I'm sure the job market is good, but you should look into that. And then I shadowed, no, I think I shadowed physicians once in medical school, like in the first years that make you shadow some doctors. Uh, Again, it's fun to kind of be there, but you're just standing there and you're not part of it. So please consider scribing instead of shadowing if it's something that's possible for you.
If you have ADHD, shadowing is not good for you. Um, yeah, the only thing that I would just say is we did a whole presentation on this. It's a 2-hour presentation, and there's a bunch of slides in there. Um, Emergency rooms are not accessible to a lot of people, and so we put a lot of tricks you could do to shadow. But I would just say that if you're, and I think we talked, the UCI dean spoke last night. He said if you are putting 300 or 400 hours of shadowing, we start questioning like, what kind of person are you that you spend this much time going in and they didn't put you to work? So shadowing is great to get your foot in, but what Dr. Jerry said, that there's scribes that are out there, that it's not just for emergency medicine. They have them in all kinds of fields now.
Yeah.
But if you there's also doulas, and so check out that workshop. I mean, if you're interested in women's health and OBGYN, being a doula is only, I think, like 30 hours or 40 hours to become a doula.
And
And
I'll give you some other advice as well. If you like, say you go through the volunteer department of a hospital and you request to be in the emergency room, wherever it is you end up, I see lots of students just stand there, right, with their little polos, and they're just standing there waiting for somebody to come get them to do their job. That is not the case, right? So when we are working, we are focused on our patients, on what needs to be done. And if there's somebody standing behind me with a polo shirt that has not introduced themselves, I will ignore them until, because I don't know who they are, right? So if you are volunteering, so important. And I know it feels weird, but when you think the doctor has a little window of time, say, hi, hey, I'm Maria. I just want to let you know I'm here volunteering and I would love to help you with anything you need help with. If you see anything interesting, can you come and get me? Right? Just basic things. And then I'm like, oh, cool. This person wants to learn. So now I know, and I'm still working and I'm still focusing. But when somebody weird comes in and has a weird thing, I'm like, hey, come with me and come see. Right? So just, you're not bothering the doctor by introducing yourself. It's actually respectful, and you're letting them know you want to learn. You are there to help them. Hey, you need a gauze? I can go get it, right? You need, I don't know, whatever it is you need, I can help you. And become familiar with your environment, where things are. You can ask the nurses, right? You don't have to ask the doctor, where do I find a gauze? You go and you ask somebody else, but you get the stuff. And if you get good at it, like scribes often do, you start anticipating the needs of the doctor. That's even more amazing, right? So, hey, here's a gauze you probably are going to need in 2 minutes, right? So that is amazing. And then you create a relationship with this doctor, and then you can get a letter of rec, and you guys know the rest.
yeah, and I would just tell you that start with the nurses first, because there's more nurses and other staff than doctors, in usually the ER. I could just tell you, because they're the only place that doctors stay for the whole time. But using the nurses as a gatekeepers, because they tend to also be really good entry points into things, what's happening, and they're more likely than not, they'll introduce you to the doctors,
Yeah.
which breaks the ice. So don't be rude to the nurses. That's all I got to tell you. Is would this is the question: would you recommend becoming an EMT, um, or ER tech eventually, for clinical exposure as an undergrad?
I mean, I think it's a fun route. Like, I would have done it when I think about it. And if that's something that attracts you, I think it's great. You don't have to, though. If that's gonna sort of make your path longer, I wouldn't necessarily. But if it's an option for you, I think it's great. You can tell them more about, being a tech in the ED, but it's fun, right? You're there, you get to do a bunch of stuff. I think it's an option. I'll put it that way.
Yeah, I mean, being an EMT is great, but if you're just going to get an EMT just to get an EMT, it's like there's a lot of things you could do. Like one of the things I do is I do rock med and I show up to events and show up to concerts and 49er games and other stuff. And it's all volunteer, but you get to like put that into use and you get a free concert. I mean, I've seen like a lot of good shows for free.
So I'll
Uh,
piggyback on that because I also do event medicine. So once you become a doctor, you get paid
yeah.
$170 an hour to stand there at a concert and take care of some drunk guy.
Yep. And yeah, and I mean RockMed is volunteer, but there's a lot of paid organizations that you could do.
Yeah.
But just know that if you are working in the ER as an ER tech or any of those positions that you do as an undergrad, um, your number one priority is work, and they're not really gonna care about, do you have an OChem st exam to study for and all those things. So just know that like with great, what is it? What is that thing with Spider-Man? With great power comes great responsibility. So you have that responsibility that you can't like call in sick or you have to work your shifts and all those other things. So, um, and so just know that anytime somebody is paying you something, they expect things back. But volunteering or even like doing scribes is a little bit more flexible, I think. Um, Scribing is also a really good thing. But yeah, we have a whole list of things you could do in there. Um, this person wants to kind of piggyback from the EMT ER thing, clinic experience. What about medical assistant?
Um, Medical assistant is okay, but I feel I would do more of a EMT ER tech if I had to choose. So I work with a lot of medical assistants, and it's okay. It's a medical assistant. Basically, takes vital signs. They will do an EKG if an EKG is needed. They will maybe collect some quick lab tests, like they can poke your finger and get a glucose or get a urine test. And then medical assistant is also trained in a lot of clerk work, so answering the phone, putting in something in the computer. It's mainly to assist a doctor in an office, in a way. So if I had to choose, like if you think emergency medicine might be something for you, I would go with the EMT or ER tech route for sure.
Yes, and for some of us that have been in the ER, being in the clinic is like the death of you. So,
Absolutely.
this is another question. I recently started volunteering in the emergency department, but I feel nervous about offering help because I assume the staff is busy. What advice do you have, and how do you speak up to offer assistance confidently?
Yeah, that is a great question, and it kind of goes with what I was saying a while ago. So I know it can feel really intimidating. I think, like it was mentioned before, approaching the nurses, even the chart. I would go with the charge nurse, like find out who the charge nurse is, and just say, "Hey, I'm volunteering here. Would you mind introducing me to one of the doctors, or who do?" Because they know the doctors well, right? So they know if there's like a grumpy doctor, they won't waste their time and they won't make you waste your time. But if there's a nicer doctor, they'll say, "Oh yeah, I'll introduce you to Dr. So and so." And then you go and I think the words that are most helpful for me are to say, "Hey, I'm a volunteer. I'm a pre-med. If there's anything I can help you with, or if there's something interesting that you see, can you please come and get me? And I'm happy to work with you today." Right? Like something along those lines. And then you'll see if they kind of interact or not. But I don't think I think it bothers me more to have somebody standing behind me who's not talking to me than to a quick interaction. It has to be like 1 minute of "this is me. I'm excited to be here. Please let me know if you have anything exciting to see." Right? That's much better. And you show some confidence and you show interest. And I like that much more than somebody just standing
Yeah, I would just say, yeah, I mean, like if you're showing up to the same thing, week in and week out, and you're not speaking to anyone, people will think you're weird. ER people also tend to be very like, you know, we're like just the facts, and so just it's just a personality that people have. So don't be shy, but also like when they're intubating a patient, or doing something with a patient, or they're really busy, and you see, you pick it up, like you pick up on their facial expression. That's not a good time to do it, but there's a lot of downtimes in the ER, and but also be interested in people. Like, if there's a nurse there, say, hey, how did you become a nurse? How did you become this? Asking him those questions, I think, are really important. And it is, I don't want to say nerve-wracking, but it's a skill that you have to pick up, because once you're a doctor, you have literally 2 minutes before you're putting, your hand in someone's body parts, or asking them very intimate questions within 30 seconds. So it's the skill that you have to learn. And I think it's a good time that you could experience that. But also, like, if it's a teaching hospital or it's a bigger and they have volunteers, you're not going to be the first volunteer they've seen there. So they kind of know who you are and why you're there. So yeah, and you try and fail in life, right? Um, this is somebody wanted to know, what activities, experiences did you have prior applying to emergency medicine residency? If we know we are interested in EM during undergrad, post-bac, should we take additional gap year to do EM related jobs before actually applying to medical school?
Mhm. Um, I don't think it counts that much. Like you don't have to do EM related activities to improve your application to medical school. I think it's as long as it's something related. You can also not, right? You can also have your undergrad years and your volunteer and like the whole thing. And then in your gap year, you decide to explore another culture, which is absolutely, acceptable. Um, but other things that will add, I think things like the stuff we've been talking about, either scribing, EMT, um, maybe some, like austere medicine trip or something like that would be interesting, I think, in an application. Again, not mandatory. I just think it would make somebody interesting.
There's also another thing, um, that most, like the larger ERs that are connected to medical schools, they're called MRAP, which is like Emergency Medicine Research Associate Programs. And I don't know this person lives, so I couldn't really tell you, but I know that they're all over a lot of bigger ERs. They have that. They use undergrad to collect data, and that's a really good experience as well. Um, this is um, this is another question. This is actually an interesting one. Were there any aspects of being a doctor that you didn't anticipate? Did anything affect your commitment to the profession or change your perspective throughout your journey?
This is a good question because I think we all start very like gun ho. I'm going to do anything it takes, and I'm going to.
Hello?
So,
Oh,
hello.
you just froze for a second.
Oh, it's good. No, I think throughout the years, again, I've been doing this for 13 years now. I think you start with your identity being your job, and medicine is your identity. And as the years go, I would rather become much more me and my family. That's rather than me, the doctor. So I think that varies with each person, but I think you 100% a doctor, right? And then as years go by and you start a family and you have or you want to do other things outside of medicine, and in a way we are so we like our expectations are so high as students and undergrads that we would never allow ourselves to be interested in other things, right? Like I like medicine, but I also like knitting or whatever it is, right? So maybe you want to dedicate more time to knitting when you're in your 40s than when you're 20s. But I think that that has been the journey for me where I started like 200%. This is the world. And as you become older, you become transitioning into other things. Like maybe it's okay not to pick up 25 shifts. I'm okay just doing 10, right? So again, burnout is real. I think I absolutely hit burnout at the end of COVID. It had been very, very intense those years in the emergency room. And so also things I didn't expect was maybe not enjoying my shift, right? That was like it doesn't feel right when everybody pisses you off, when everybody annoys you like that. You can tell you are absolutely burnt out when you don't care about the patient. Like the patient tells you whatever, and you're like, oh, and you roll your eyes. Everything. So we need to like re-examine things. Um, and so other things that are sort of disappointments in medicine is the health system, right? It's such a disappointment that patients don't have access to care, that have huge bills to pay. A lot of our role in the emergency department is advocating for patients, especially in a place where I work, like downtown LA, where patients are uninsured, they don't speak the language, they don't know how to navigate the healthcare system. A lot of times we find people with like a mass and they have cancer, and you know that if you discharge that patient, they won't get a biopsy for 6 months, and so their cancer won't be treated for 8 months. Admit them to the hospital, they will see the oncologist the next day, they will get a biopsy, they will get labs, they will get the whole thing in that admission. So then you kind of have to make up a reason to admit them because they're actually okay. They have a cancer, but they're okay. They could go home and, get an appointment. But so then you're like, oh, well, I think the patient is anemic and their blood levels are low. Like you have to really play this role where you are saying, no, this patient is really sick. They really need to stay in the hospital. They really need to stay because I want them to get the care they need. Right. So that's a whole nother role that you have as a physician, is not only looking at labs, looking at an EKG, but how can I help this patient get the care they need? And so those are the big disappointments in medicine. I think another disappointment for me personally is sort of the culture within emergency medicine is not very conducive to, like, I have a personal emergency, I can't go to work, right? That's something that I'm hoping will change within emergency medicine, because it's really hard to get a shift covered or to somebody when you have an event and things like that. Everybody has their own lives and they're, yes, go ahead.
You keep on freezing.
Oh,
There you go. Sometimes it's just checking your laptop for the Wi-Fi.
okay. So yeah, I think I was just talking about that the support within emergency medicine could be better, I feel like, within colleagues and directors of emergency medicine, and then the healthcare system as a whole.
Um, this is another question about I'm curious about the diversity in medical school, particularly to terms of age. Do you find that students come from a wide range of age, or there's a typical range in most students? Like this person wants to start med school in their late 20s.
No, I mean, there is a great diversity, and I feel like the average age is whatever it is right now, like 20s perhaps. But again, I went to medical school with Dr. Ceballos, who started in her late 30s. And so we tend to see, I don't think we had very young or super young students in our med school class. But I think, whatever it is, your age, you will find your fit and kind of go along. So that should not be a concern.
This other person wants to know, is it just in medical shows an exaggeration, or is there a worry among physicians in the emergency department about violence and about violence in cases of gunshot wounds, or violence from agitated persons, or just healthcare safety overall?
Yeah,
Um,
that is an absolutely great question. Oh, were you done? Sorry.
yeah, no, no. I
Yeah,
would just say
no.
yes.
Yes, absolutely. Violence in the emergency room is an everyday thing. I'll tell you that as physicians, I feel it's a bit unfair because in a way, we are protected because when we have agitated patients, which is every day, who runs to an agitated patient? The techs and the nurses. And when things are good and the patient is restrained, then the doctor comes in and is like, oh yeah, give this medication, let's do this. Right. So in a way, physically, we are not the first ones next to an agitated patient, and nurses are, get much higher rates of violent episodes. And it's very sad because the hospital administration tends to not be super supportive with hospital staff when somebody gets assaulted or that sort. I work at the LA County Jail, so having you have to have awareness every second you are working, because things can happen, right? So it's your responsibility to have that awareness, um, to not be too abrupt, perhaps with a psychiatric patient, not like talk to them in their face, because they're going to punch you if you do that, right? So you have to keep your distance. You have to, with psych patients, I was always taught, like, don't wear your stethoscope around your neck because they can choke you with it. Like if you lean over to talk to them and they're in a gurney, they can just, choke you with the stethoscope. You have to kind of get a sense of what they need, right? Because if you are just obnoxious and ask them 20 questions in a row, they will just like burst at you and spit in your face, right? We have patients that come with spit masks, and then you think you're cool and like, hey, yeah, remove the mask, and then they'll spit at you again. So just awareness, in the jail, it happens all the time. I had a physician assistant who I felt was lacking all of these common sense things. And she would wear a headlight, like the ones that ENTs wear, with this super bright light. And this agitated patient was there, and she walks straight into the patient without even knowing. And this light is like beaming in their pupils. And of course, this person became super agitated, and it was a whole deal. So, yes, violence in the emergency room is a true thing. You see agitated patients every day. Again, I work in downtown LA next to Skid Row. So lots of, not even overdoses, lots of agitated patients who are on different kind of, intoxicated with different drugs, which make them do very wild things, running naked in the street, climbing a building naked and jumping from the third floor. Lots of that. So that's a very common occurrence. But again, think again, like, who better than me, who better than you to help this patient? I know what drug to give them. I know the dose to give them. I know how to keep them safe so they won't jump off another building. I know how to get them psychiatric care. I can help them navigate the system. So you have a lot to contribute. This is not like another agitated patient. This is like, no, I need to help this patient, right? Because this is a danger to others. He's a danger to himself. And so let me help them by doing A, B, and C.
Yeah, I would just say that healthcare violence against healthcare workers is a national issue. It happens a lot of times, and there's things that, I mean, you have somebody's blood pressure, I mean, not blood pressure, that's in the fever, they're delirium and agitated. People get in car accidents, they get their head bonked, and, they're agitated. So a lot of people, it's not that they do it on purpose, is that because of their imbalance in their chemical or physical things like that. So that's just something you deal with as a physician, that you deal, in healthcare, you deal with people that are not their best, and then you deal with people that want to come and hurt you, and that's just part of the job, just like any other hazard there is. But the good thing in California is if you're a frontline health worker, it's a felony. So, you know,
And the other thing I'll add for emergency medicine is don't expect thank yous ever, right? So
ever.
if you are a primary care doctor, the patients will bring you like their home baked bread, and they'll bring you flowers and all these things. That is not a thing in emergency medicine. You will get cursed at. You will be called every single name under the book. It's cool, right? Like, I'm still going to help you. You can yell at me all you want. That's just part of it, right? So, but it's also important to expect, like, I had one patient, I worked at an urgent care once, and a guy had an acute heart attack, and so I sent him to the hospital, and then I got flowers like 2 days later. I was like, what? This has never happened to me. So that is not a thing. You will nobody will say thank you 95% of the time.
Yeah, during COVID, when people were bringing us these restaurant foods, they were like these really bougie places. We were like, we didn't know what to do. We're like,
Yeah.
what is this? Why are they giving us food? Like, some of us were like, is this spiked or something?
No,
We
it
were
feels
just
very
like,
strange when you get a thank you and it feels amazing, but that is not a daily occurrence.
yeah. Um, so yeah, it's called being jaded, but that's a whole separate thing. What are some things you did that you felt helped or could have helped you succeed in medical schools and find the best balance of academic success and your overall well-being?
I think finding my cohort of people I was going to hang out with during med school and have fun with was, I mean, I would not have graduated medical school without my little core group of friends.
The posse.
Yes, within my posse, like within that posse, we had like the super nerdy, like one that had the whole, board full of formulas and the whole thing. And then there was like two of us that would, I mean, I always struggled studying. Like I have to read things 10 times to actually get it and understand them. So I had to study, I feel like more than others. And so I found that person that had sort of a similar, similar to me. And so we would study together and then review the material. And then four of us would get together and review the material. And then that same group, we would go out on Friday and Saturday, right? And have fun and do things. And so I feel like playing hard is as important as working hard. So make sure you have that balance. It's okay to go out and have fun and be responsible when you have fun, but you have to do other things. So I had a struggle in undergrad because, I'm from Argentina and Argentinians like to party. And I met the whole Argentinian crew in LA during medical school. And that was a big problem. Um, because they would party every single weekend. And I was like, no, I have to study. No, I have to study. So you have to find that balance, but don't just study all day because that will not get you anywhere either. You have to do fun things that you enjoy, whether it's going for a hike, whether it's taking a Zumba class, whether it's, hanging out with family, right? You go, you visit somebody or you friend, like do something outside of your studying, because that's an important balance.
Um, this person wants to know that they're in their 50s and they want to go into medicine. Can they do something to speed up the process?
Oh my God,
Uh,
that would be fantastic. But no, the answer is we can't speed up the process. The only thing you could do is sort of pick a residency that is the shortest in nature. Like that would be maybe family medicine, is a 3-year residency. Actually, emergency medicine, most places are 3 years. They're trying to make them all mandatory 4 years now, but a lot of places have 3-year programs. I'm not aware of anything that would shorten that, to be honest. I don't think so.
yeah, you have to jump through all the hoops, unfortunately. Um, I know there's some 3-year medical schools, but that's like really fast. There's no like, break. And I don't know. I mean, there's a couple of people that have done it, but
I mean,
um,
I feel like if you are maybe trying to do bread and butter things, like maybe another health career, like a physician assistant, would be shorter for sure. Again, not the same thing as becoming a full, doctor, but you still get to do a lot of clinical things, and that may be an option.
another question. What did you like about OBGYN that made you feel conflicted at first? I also really like the idea of OBGYN and emergency medicine.
Yeah, so I love OBGYN still, but I love women's health. I think educating women in their health is so interesting and needed. I love procedures. Again, OBs do a lot of OR time, right? Like C-sections. I love being in the OR. I love surgery too, but I felt like everybody was super mean to me, so I would never do a surgery residency. That may have changed, but at least in my time, people were assholes. And so, no, I was like, no, I'm not joining this group of people. But OBs are super nice. They are really, smart, capable physicians who cut your abdomen and all the layers there and take a baby out and take care of this baby and take care of a pregnancy. I mean, it's so fun to take care of pregnant moms. Like all that stuff was super fun. And again, the fast, like the urgency of a procedure was also attractive to me. Like, oh, this baby's coming now, we need to go, right? That's very similar to the emergency room where you have to make quick decisions. During labor, right? Things might go wrong. Like I've delivered a bunch of babies and it's so exciting and amazing. Like even as an ER doctor, I've delivered babies outside of the ER in like dirty trucks. I've delivered babies inside the hospital. And then when something goes wrong, you also have to act quickly. So I think those are the overlaps of OB, GYN, and emergency medicine. In the end, though, I did not want to miss out on all the other stuff that emergency medicine has to offer that OB doesn't see.
Yeah, I'm afraid of yeah. God bless whoever goes into OBGYN because that's
It's still fun. I still think it's super fun, but I would still pick emergency medicine.
my favorite question is when is the
What's the
fat.
question?
No, I always like whenever I see a pregnant person come into the ER, it's like, when was their last menstrual cycle? Because
Oh,
and then you look at it, it's like 22 weeks, fast track to be.
no, I think it's super fun. To deliver babies is the most amazing experience you could have. It's truly amazing.
Yes. Well, as a man, I could tell you that I'm glad that I don't have
Yeah,
to.
yeah, yeah. You pass it on.
It's like, oh. Um, the other question is somebody, if you could go back in time and give yourself advice when you started your pre-med journey, what advice that would be?
Um, I think the advice beyond getting good grades, right? Because grades get you in. You can be the most amazing person, the most amazing personality. Nobody will care if you don't have good grades. So focusing on grades. I used to do a lot of volunteer stuff. So maybe finding that balance initially of less volunteer stuff and more academics if you're not the best. Like I was not the smartest in the room or the best, the better grades. So focusing on grades. Like you mentioned earlier, I think finding somebody who can teach you study habits and how to take tests. I'm a really poor test taker. So I would have wanted some more advice on test taking or maybe some more help in that because I've struggled always with test taking. Um, and then again, find the value in you, like because that carries on, right? It carries on from today until forever. What is your value? Because that you're going to have to talk about yourself in interviews, on paper, in an application, and so feeling okay with that takes time. And just to say, even if you practice, maybe practice an interview with somebody, to say, I'm good at this, and this is my worth, and this is why you need me in your medical school, right? So getting that thought and practicing in your head that you are good and you have value, I think carries a long way.
Another question, how do you balance now with family and work and everything with 3 kids, which
Yeah. So my kids are 14, 10, and 8. And so I think something I've learned
yikes.
along the way, you have to learn to say no. And that is huge. Like as simple as it sounds, it is huge. We are programmed to say yes to everything as students, right? Because we want the next step. We want to get in. We want the letter of rec. We want the experience. We want to write this down in our CV. So anything you are asked to do, you're like, yes, of course. Yes, 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 I will do it. Yes, right? And you go through residency and you give lectures and you help this group and then you volunteer with this group and you truly want to do all the work, but sometimes you have to say no, right? You have to say no because I need to go to the dentist myself and I haven't seen a dentist in 3 years, right? So as simple as that sounds, or no, I don't really love this project. Like you're asking me to speak to this group and in a way you don't want to do it, but you do it because they ask for your help. So you're going to say yes. And the answer is no. You say, I'm sorry, I'm not available to do this. Or, you know what, this is not my highest interest right now. So I will pass this on to so and so. So learning to say no is a huge deal. And I think that's number one. And then you kind of learn how to navigate things, right? You manage, and even though you think it's impossible, it is not impossible. I think just time and resources, delegating to other people to help you, all that helps to find this balance.
Um, one more question I think that's come through is, um, what if you could go back in time and go do something else, what would it be? Or would you do the same exact thing?
I think it was immensely helpful that I had no clue what medical school was like or residency, because if you knew, you may make other choices. But I also think it's fun to go into something in a way a little bit blind and you're like, oh shit, now I have to do all this thing, right? Like you do it because you are there and that's what you want to do. And maybe if you knew the details of it, you would have said, not sure. So I kind of like that I didn't really know what was coming and the entirety of what it meant to become a doctor. If I would do other things, no, I always said I would have been a dancer if I could have been a dancer, but nothing to do with medicine.
But also you get to you have hobbies that you get to do now
Yeah,
that
yeah, you can still do all your fun stuff, but yeah, I always kind of knew in my head that I wanted to be a doctor, and I never really allowed myself to consider other things. That was me. No, that's not what you have to do. Yeah.
and the other question is if you could go back in time and do something differently, what would it be?
Within medicine or outside of medicine?
Like starting in your pre-med journey, what would it
Oh,
be?
starting. I no, I think I did what was available, and I maybe I would have started earlier. Like I just didn't know when I was at SMC. Like I was taking swimming classes in the summers. I was taking typing classes in the summer when other people were doing internships and things like that. So maybe I would have started earlier, the kind of gathering the information and knowing what made me a strong applicant and things like that. But again, I also want you to have fun and not worry, like not have every thought in your head be about medical school, but have fun, travel, do things, hang out with friends. Like that's so important.
Very cool. If there's no more questions, we're gonna let Dr. go. Oh, by the way, Efrain said hi.
Oh, amazing.
I just texted him
Oh, cool.
and I just texted him like, hey, somebody knows somebody dropped it, and he said, tell her I said hi. So
Yeah, so I'll tell you guys, we had our little in our med school class. I was with my little like Latino posse, except one of our members of the posse was not. And Dr. Talamantes, who he's talking about, Efrain, was with a group of like 5 or 6 Latino guys. And so it was always like we would talk back and forth with each other and make fun of each other. And within his group, like, right, he is the CEO of Ultimate today. One of the other guys is the director of trauma at Palmdale Hospital. He's a great trauma surgeon. One of the other guys went into the Central Valley and has his family medicine practice there. So everybody is just, I'm very proud of everyone that, was within our friend group, and we were part of the weekends and make fun of each other. And I think everyone is doing great things today, so we can all be an inspiration for each other. And you should find the same within your cohort, right? Like whoever you're doing this, going along this pathway with, it'll be amazing. You guys will do great things, and that feels really good.
I would just say that Americans we're taught this individualistic thing, but I would tell you is without community, we're all dead. Like you got to find people that are much smarter than you and much more talented and much more um, fun than you, I guess, because you can't do it by yourself. Um, this is a question somebody's asking. After you transferred from SMC to UCLA, during UCLA, did you do any internships or research? And I think you covered that a bit, but do you want to go a little bit more in detail?
I did research. Again, I didn't enjoy it. I honestly had no idea what it was doing. Like, I did not understand what the lab was doing at all, but I was like, sure, I'll do this pipette, right? It kind of sucks. Like, if you find another experience that you enjoy within a research group, please do that. That's what I ended up being. Like, you had a paycheck, and I went on my CV and I was doing the research. But if you find other experiences that are more fulfilling, please do that. I didn't do an internship. I think it was more research. And then I would do a lot of the volunteer stuff. Like to me, the inspiration came from the trips to Tecate or Tijuana, where we went with the pre-med group and set up a clinic. And I still go to this day, right? The other day, I went back with the group I used to be in as an undergrad, which was CCM, and we went to Mexico and we set up a clinic. Except that this time, instead of being the volunteer that takes the intake form, I am the physician taking care of all these patients, and so it feels pretty good. So to me, doing volunteer work is what kind of fills my bucket and allows me to keep going to do other things. But yeah, that's what I did as an undergrad, was mainly research.
Awesome. Well, there's not many questions, and I don't want to hold you up any longer. Um, but thank you again for coming. Great seeing you, and if nobody have any other questions, we'll
Yeah, thank you. Please feel free to send me an email or Instagram. Send me a message on Instagram if you have other questions that you think about later. No questions are dumb questions. Like anything that comes up, please reach out. And
do you want to put it in the chat? Or do you
oh
want me to
yeah,
put it?
yeah, sure. Let me find the chat first. There you go. So that's the Instagram and then email.
Awesome.
Awesome. All right. Thank you, everybody.
Well, thank you again and have a great weekend.
Yes. Thank you. Bye.